Welcome, everyone. My name is Dr. Marcia Halstead. I'm a professor in the School of Nursing at Emory University, and I have the pleasure today of introducing Dr. Carlos Del Rio. Dr. Del Rio is Executive Associate Dean at the Emory School of Medicine and the Grady Health System. He's Distinguished Professor in the Department of Medicine, Division of Infectious Diseases at Emory University School of Medicine. He's also a professor in the Department of Global Health in the Rollins School of Public Health. He co-directs the Emory Center for AIDS Research as well. Dr. Del Rio's research focuses on early diagnosis, access to care, engagement in care, compliance with antiretroviral medications, and the prevention of HIV infection. He has worked for over a decade with hard-to-reach populations, including substance users, to improve outcomes of those infected with HIV and to prevent infection with those at risk. He is also interested in the translation of research findings into policy and practice. His international work includes collaborations in the countries of Georgia, Ethiopia, Mexico, Kenya, and Thailand. He has also worked on emerging infections such as influenza and, of course, most recently, has become an expert on the COVID pandemic. He has received numerous honors, and among them being selected by the Atlanta magazine as one of the 55 most influential foreign-born Americans in 2007. In 2013, Dr. Del Rio was elected to the National Academy of Medicine, and in 2020 was elected as a Foreign Secretary of the National Academy of Medicine. Please join me in welcoming Dr. Del Rio.
Thank you, and I want to thank the organizers of the conference for inviting me to give this talk. I'm going to be discussing today COVID-19 in older adults, and in particular in populations living with HIV. As you know, over 50% of people with HIV in the United States are now over the age of 50. And COVID has been particularly severe in older adults. There is an increased prevalence of age-related comorbidities such as cardiovascular disease, diabetes, hypertension, fractures, cancer, and neurocognitive impairment in persons with HIV. And many of these comorbidities increase the risk of severe COVID-19. As you can see here, 95% of COVID-19 deaths have been in people over the age of 50. And then you can see here in the red the distribution of cases by age strata. And you can see that while not a lot of cases have occurred in people over the age of 50, a low percentage of cases, a high percentage of the deaths have occurred in people over the age of 50. Furthermore, if you can see here, the risk of death after COVID-19 infection is virtually zero in a man, this is an unvaccinated individual under the age of 25. But if you get over the age of 75 and you're an unvaccinated person, your death is significantly higher. For this reason, the Centers for Disease Control has said that 8 out of 10 COVID deaths have been reported in the U.S. in people over the age of 65. And it is this what is particularly concerning to all of us. You can see the information here updated recently, and you can see again when you look at most deaths from COVID-19, over 200,000 deaths have occurred in people over the age of 65 to 74, 75 to 84, or over the age of 85. Really, that's the group that accumulates, a large number of the deaths that have occurred. So what are the potential reasons why patients with HIV have worse COVID outcomes? Well, clearly they are immune deficiency or have immune dysregulation. Patients with immune deficiency, such as organ transplant recipients, are at high risk of severe COVID. There is prolonged SARS-CoV-2 replication in immunocompromised hosts. And in fact, we know that, or one of the theories is that this is how some of the variants have evolved. In addition, we know that persons with HIV with low CD4 counts are increased risk of severe COVID, as they do for other diseases such as influenza. And there is residual inflammation in patients even when they're receiving antiretroviral therapy and they're virologically suppressed. This is most pronounced in persons with HIV with low CD4 count nadirs, incomplete CD4 count reconstitution, or low CD4-CD8 ratio. Finally, there's immune dysregulation, sort of a legacy effect, and the impact of COVID-19 on that is not certain. As we discussed, patients with HIV are at high risk of comorbidities that put them at risk for severe COVID. And there are social determinants of health. Persons with HIV are more likely to be racial, ethnic minorities, and poor, which again we know is associated with worse outcomes from COVID. Let's look at the issue of comorbidities in persons with HIV. This is a study that was done in a national survey of persons with HIV over the age of 50 in the UK. 97% of them were on antiretroviral therapy, but 31% had hypertension, dyslipidemia, almost a quarter had depression, renal impairment about 15%, cardiovascular disease and 12%, and obesity and 11%, type 2 diabetes and 11%, and osteoporosis 5%. And multiple comorbidities were common with people over the age of 50 having more than one comorbidity. And in fact, when you can see here on a color scale, anything that is in sort of that's above the brown is having two or more comorbidities. And you can see the older you get, once you get over the age of about 60, almost 50% of people have two or more comorbidities. In addition, persons with HIV and COVID-19 have high rate of vulnerability and social vulnerability. This is from a study that was done in looking at the disproportionate burden of COVID-19 among racial minorities. And again, you can see here that 83% with non-HIV comorbidities were associated with severe COVID, such as obesity, cardiovascular disease. A large percentage of these patients were Black or Latinx. And 50% of them, the reason they had high risk of COVID is they were exposed in congregate settings. So it's where you live, where you work that puts you at high risk. So the literature has been mixed whether HIV itself is a risk factor for severe COVID. There are several studies that have not found an association between HIV and worse COVID-19 outcomes, and they're summarized in this table. They mostly come from here in the United States, and they have compared persons with HIV who had COVID and persons without HIV who have COVID, and they have not shown an increase in ICU admissions, in mechanical ventilation, or in mortality in these studies. However, there are other studies that have shown an association between HIV and worse COVID-19 outcomes, and they come from studies, two of them from the U.S., but also one from the UK, a couple of them from the UK, and one from South Africa. And in all those studies, there has been an increased mortality effect seen in persons with HIV who have COVID. So the jury's still out, but I think what we learned from the studies is that it's really important to think about HIV as a risk factor for severe COVID in some circumstances, and we'll talk about those in a little bit. COVID-19 also has been shown to make worse outcomes in other immunosuppressed populations. This is a study in persons with HIV, but also in those with transplants, and you can see persons with HIV and solid organ transplants, when they have COVID, they're more likely to be hospitalized and require mechanical ventilation. And the increased hospitalization risk is driven mostly by the high burden of comorbidities in both groups. So what are factors associated with decreased survival in persons with HIV who have COVID-19? And in this study, the most important risk factor was again, these were mostly people on antiretroviral therapy, mostly virologically suppressed, but older age was a big risk factor. In addition to that, there were others such as chronic lung disease, hypertension, and a low CD4 count associated with decreased survival. And in a separate analysis of a European cohort of persons with HIV, having a CD4 count under 350 was associated with decreased risk of severe COVID. So in summary, I think some studies have suggested, but not all of them have suggested that persons with HIV have worse COVID-19 outcomes. It is not yet clear if HIV is itself a risk factor for worse COVID, independent of comorbidities and socioeconomic factors. Studies of HIV and COVID-19 outcomes that adequately account for immunological function, comorbidities, and social disparities are still needed. And while we'll wait the studies, I think it's really important that we prioritize persons with HIV for COVID-19 vaccination for two reasons: higher risk rate of comorbidities and the social inequities that make COVID-19 prevention, such as social distancing and working remotely, being more common also in persons with HIV. One of the issues that we have observed during this pandemic has also been the resilience in older adults with HIV during the COVID-19 pandemic. And this is a study that was done on a questionnaire of persons with HIV evaluating for resilience, frailty, depression, anxiety. Median age was 54, 79% were non-resilient, and only 20% were resilient. And being female and over 50 were predictors of impaired psychological resilience, and loneliness and duration of HIV were predictors of non-resilience. Now, the good news is that persons with HIV older Americans are more likely to be fully vaccinated. And you can see here that in the U.S., people over the age of 50 are much likely to be vaccinated than those under the age of 50. However, even when you're vaccinated, the risk of death after getting COVID, even if you're vaccinated, still continues to be high, especially in people over the age of 65. So it's over the age of 65 when you start seeing an increased risk. And in fact, a 75-year-old woman who is fully vaccinated against COVID has a mortality that is, that is about twice of somebody who is a 65-year-old man or a 65-year-old obese individual. There has been significant consequences of elderly having COVID and having isolated as a result of that. And what we see is, we have seen increase the functional ability being decreased because of isolation, because of decline, and that has led to frailty. And as a result of that, you can have potentially, more trauma, more falls, more orthopedic admissions, and that in itself, we know, leads to worse the outcomes in older individuals. So how about COVID-19 vaccination in persons with HIV? I think there are several studies that show that HIV increases the risk of death and poor outcomes in persons with COVID-19, and other studies don't support this, but the NIH has recommended that people with HIV be considered a high-risk group when making COVID-19 vaccination priorities. And in fact, there are persons with HIV, regardless of the viral load, should be vaccinated, and that's an A3 level recommendation. Not a lot of HIV patients have been included in the phase 3 studies, and you can see here the Pfizer study enrolled 196 persons with HIV, but they were not included in this study in the results published in New England Journal of Medicine. Moderna enrolled 176 persons with HIV, one person who received the placebo and none who received the vaccine developed COVID-19, and there were no safety concerns reported for people with HIV. The Oxford AstraZeneca study recruited 160 persons with HIV in the UK and South Africa, but none were included in the main data set that was published in The Lancet. And finally, the Janssen vaccine recruited 1,218 persons with HIV, or 2.8% of all participants in the study, and there were 2 cases of COVID in persons with HIV receiving the vaccine, and 4 in people with HIV receiving the placebo. So again, small numbers that you cannot really make any inference about. So why do we make vaccinating COVID-19, giving COVID-19 vaccination to persons with HIV a priority? Well, number one is their low CD4 count, the high number of comorbidities, aging, social determinants of health, and housing instability, which makes them less likely to be able to quarantine. And in fact, the experts say that both the British HIV Medical Association as well as the CDC have recommended that people with HIV be considered a high risk of COVID and therefore be vaccinated. And the CDC is very clear that this needs to be done irrespective of their immune recovery. Now, do persons with HIV respond to COVID-19 vaccination? And there are a few studies showing, at least at this point in time, that there's no difference in IgM or IgG antibodies against the spike protein in HIV persons versus those without HIV when followed over a short period of time, about 4 months. But we need to remember that it's possible that the level of protection after vaccination may not be the same for those with HIV that those without HIV. And we don't know if the response is going to be different in people with low CD4 counts, and it's likely going to be less. And therefore, we need to be on top of this, and we need and we really don't know how long people are going to be protected. So there are a lot of questions, and the HIV Medicine Association has a very nice Q&A, FAQ, where you can go and try to answer these questions. So in conclusion, older adults have a disproportionate burden of COVID-19, and persons with HIV are at increased risk of COVID and severe outcomes due to comorbidities, age, and social determinants of health. And persons with HIV should thus be prioritized for COVID-19 vaccination. And with that, I'll end, and I'll be happy to answer any questions.
Thank you so much, Dr. Del Rio. That was extremely interesting and very helpful overview of COVID and HIV and aging. There are a couple questions. First question on the issue of resilience. Many studies have shown that people with HIV tend to be resilient. They've lived through a near fatal disease, now, of course, controlled and chronic. But they've had, a lot of barriers to overcome. And so those findings on individuals with COVID or during the whole COVID pandemic, lower resilience is a little interesting. Do you have any thoughts on why that might be?
I'm not sure. I think, the isolation plays a big role, right? And being in isolation, I think it has made tougher for people to be resilient. I think being lonely, being isolated, not being able to socially interact with others, I think increases in a significant way your depression and your inability to cope with stress.
That makes good sense too. Um, what about long COVID in people with HIV? Have you seen more issues with that, especially in like the older adults?
Well, I think older adults are at high risk of COVID-19 and COVID-19 complications and death. So, yes, I think the older you get, even if you're vaccinated, you have to be more careful. You have to be more worried that if you get infected, you could potentially get quite sick.
Kind of thinking about the vaccines, are any of the has there been any research to show that one vaccine seems to be more effective in people with HIV?
No, there hasn't been, but we know that the mRNA vaccines seem to be somewhat better than the adenovirus vaccines, and particularly to the Janssen vaccine, just because it may be antigen, maybe multiple doses. But in general, no. I mean, all the vaccines will behave the same way in somebody with HIV than without HIV.
And have you been seeing much vaccine hesitancy in
I think there is. But I think also it's about relationships. I think if you trust your provider and you like at the Grady IDP, there's been less hesitancy. But if people want to be vaccinated there, they want to do what their provider tells them to do. They don't want to go somewhere else.
the new clinical guidance on HIV and COVID just came out at the end of February. Can you provide some insight into that? Specifically, they talked about treatments for COVID, recommended treatments.
Well, I think a lot has advanced in the area of treatment, and I think if somebody with HIV gets COVID today, now that we have better treatments, we have monoclonal antibodies, we have antivirals. Those persons with HIV should clearly be a priority to get both a monoclonal antibody infusion or an antiviral drug, depending what the situation is.
So basically, if they think they have COVID, get tested early and try to get on treatment.
Correct.
Okay,
Correct.
good. Do you have any parting thoughts for our audience?
No, I would just say, I think that it's a very evolving field, and I think we need to, again, emphasize the importance of COVID vaccination. This is how we're going to get out of this pandemic. And we really, really need to talk to our patients, to our loved ones, to anybody we can about the importance of getting vaccinated.
Thank you so much, Dr. Del Rio. And this was a wonderful presentation. And thank you for everything you do for people with HIV.